So, my name is Bill Pennywell, and this is my presentation for exercise 486. It is on traumatic brain injury. So we'll go right into it. For traumatic brain injury, what is traumatic brain injury? Well, it's a brain abnormality that is an impairment, or it's a brain abnormality or impairment that's caused by an outside force. So a blow maybe to the head, like a violent hit to the head. It's usually seen in severe sports injuries, car accidents, military members. Maybe they get caught in some kind of explosion or an IED attack. And then also it's been found to have some, been seen in some infants from maybe when the mother is giving birth, or some other things like shaken baby syndrome, which I'll get into a little bit later. On this slide down in the bottom is some leading causes. I found that chart in, I believe it was on the website for the CDC. So that just gives you a little chart there to show you some common types. I'm not going to go too deep into all of these. Just kind of do a little brief overview: concussions, contusions, the cope, contracope. That's actually a type where you have one injury on one side of your head and then another injury on the opposite side. So you actually have two injuries to the head, which is interesting. Diffused axonal, and that's actually similar to shaken baby syndrome. It's actually a violent shaking of the head, or a whiplash-like motion that you can have that can cause that traumatic brain injury. That's presented a little bit more in the shaken baby syndrome with young children. Maybe a perpetrator shakes them or something like that. So young children or babies. So there's a couple more on there you can go through. One thing I did find interesting was this fact that 75% of traumatic brain injuries that occur each year are actually concussions. So they have that like skull fracture when they've been hit in the head. I thought that was very interesting. And it was interesting, but I also wasn't surprised at it because of today's society, looking at sports and how big concussions are becoming these days. So it was surprising, but it also it was interesting, but it also was somewhat not really surprising, because concussions are happening a lot more these days. So moving on. So who's affected by TBI? It can be any person. Kind of went over, it could be someone, a person as young as an infant, a newborn, or someone all the way up in senior citizens. And in the U.S. alone, they had 2.2 million documented cases, each year. And that's per the CDC. That's where I got those numbers from. Now, I also read on there that traumatic brain injury is 3 times more likely to happen in males than in females, and it usually is in ages 14 years and older. Now, just thinking about that, 14 years, that's when you're in high school, you're developing. Kids are playing sports, they're getting a little bit more serious about the sports they're playing, and they're trying to develop as a good athlete, so they can maybe get a scholarship. So I'm not surprised about that age, just because of thinking about it. That's like when sports are really becoming way more serious. 14 to 18, and then maybe 18 to maybe 30 or 40, you're seeing people who are getting car accidents, professional sports athletes, military members. So that's maybe, that middle age area from 18 to like 30 or 40, 50 even. And then anyone older than that, I would say, is maybe falls. If you refer back to that chart of leading causes, the majority of TBI is in falls. And I would say maybe that's from maybe senior citizens not having that balance or stability. So anyway, moving on, some treatments and prescriptions for mild TBI. There's no real prescription, just rest and over-the-counter pain relievers. So, obviously they have to be monitored closely, but moderate to severe TBI. Now, they do have some drugs that they will, like prescription medication, that they will prescribe to people. I actually found it interesting that that they would give patients the coma-inducing drugs, and they were saying that they give them that because when a brain is in a comatose state, it needs less oxygen. So they do that so that the brain doesn't need as much oxygen and it can kind of recover a little bit. It was interesting. So anyway, but there's the prescription drugs that they would prescribe. Some other treatments as far as surgery, that's a little bit more extreme. Actually having surgery to repair skull fractures, remove clotted blood, to open a window in the skull. That's actually for swelling. I'm going to get into that in a second. Rehab is more for occupational therapy, physical therapy, speech therapy. Like I said, this is a brain injury. So people are going to have, they're going to react differently to the brain injury. And I'll go a little bit more into that once we get to the signs and symptoms. But yeah, people will definitely need rehab, or therapy in some way. Because when your brain gets injured, it's not the same as getting, breaking an arm or a leg. And actually, let's just go into that for the signs and symptoms. So there's a wide range of short and long-term changes that can happen, or that can affect your thinking, sensations, language, emotions. When we talk about thinking, we're talking about the cognitive thinking, right? Your memory, your reasoning. It could be maybe your inability to speak or communicate, those type of things. And that goes a little bit with language too. Your expressions, and how you express yourself, and maybe even your understanding when you're trying to understand someone. So that can be affected. The emotions and sensations, those are things that are more like behavior, like your physical behavior, maybe even your emotions. That's like your, if you're laughing or crying, or you're very aggressive at that moment or anything like that. So it's definitely something that can really affect you. I thought this was interesting. This kind of shows a healthy brain and what's happening inside the healthy brain versus what's happening in one that's been affected with TBI. And you have to remember too, this is your brain. I mean, there's a whole list of signs and symptoms that you can go down into. I mean, blurred vision, problems with memory, difficulty walking. That's balance too. That's a balance disorder. Slurred speech, all that good stuff. Now here's some secondary injuries. These are caused by the TBI. So when you get traumatic brain injury, these are like secondary injuries that already happen. I kind of talked a little bit about surgery. When you have brain swelling, they open up, they cut a window inside your skull to allow some extra room for swelling. There's a list of all kinds of other injuries right there. So you can take a look at them: brain damage, maybe infection inside the skull, some chemical changes, maybe even fluid inside the skull. So yeah, those are secondary injuries. Further risks of TBI: if you're getting repeated mild TBI over an extended period of time, maybe days or weeks, you could have neurological or cognitive deficiencies that you're kind of dealing with. And if it's over a short period of time, like minutes or seconds or hours, that short period of time, it could be very catastrophic or fatal to you. So you have to be careful of that. I could see that in both like football players or maybe soccer players heading the ball. So I could see that. I could even see it in senior citizens maybe fall in. And again, if you look even further, some risks of those conditions, like when you get, those multiple or repeated TBIs, you put yourself at an increased risk for Alzheimer's, epilepsy, Parkinson's, and onset of other brain disorders as well. So for diagnosing TBI, it's usually pretty obvious. It's probably followed by some kind of, event, car accident, senior citizen falls, maybe a player on the football field gets hit in the head. They're probably feeling dizzy or things like that. It's usually pretty obvious. And they probably won't, if they don't know they have it, then they probably won't know until they start having problems doing, the easy tasks, things like that. So for exercise, TBI on exercise. So it's been well documented that TBI is an injury that damaged the neurological functions of the brain, and those damaged neurological functions can be restored by exercising. It kind of helps those muscles and your brain kind of put together those neurological pathways and those neuromuscular pathways to help your brain kind of recover and kind of get back to where you were. So this kind of brings me to my case study. Right now, this is my client. It's a military member with TBI, 27 years old, 175 pounds, 5'10". BMI is 25, so they're in the overweight category. No family history of heart disease. They are pre-hypertensive. Their blood pressure is just slightly elevated. Resting heart rate is slightly elevated. Everything's kind of just slightly elevated, a little bit high. It's either normal or just like slightly elevated. So and this guy has permission from his physician to start exercising, and he's kind of off all his medications. He is on over-the-counter pain relievers. But other than that, there's no other medications. So I put him in the moderate risk. He wants to increase his muscle mass and to improve his cardiovascular endurance. So for exercise testing, I put him on a 1 mile run, and then I'll go into the reasoning for some of these. The 5 rep max leg press, 5 rep max chest press machine, 1 minute push-up test for muscular endurance, sit-up test for muscular endurance, one-legged stance for balance, Romberg test for balance, and then a sit and reach just for some range of motion. My exercise prescription, pretty standard, easy to get him started. He's had a sedentary lifestyle. I kind of breezed through that, but yeah, he has a sedentary lifestyle, so gonna get him back into things, start out slow, make sure he's moving, and then we'll get into, obviously his training a little bit further. So this is kind of his weights. Now for resistance training, some of you are probably wondering why I don't have free weights on there. I'm gonna actually explain that in a second. For free weights, he has a brain injury, so he's probably needs to work on balance and coordination and maybe some stability. So I actually added in some stability and balance training 3 times a week, about 10 to 15 minutes to help him kind of recover. This is, why I don't have him on free weights just yet. And I'm going to stick him on machines. Maybe once we go through a couple cycles of resistance training and he's feeling up to it and his balance has improved, and I feel that, he's showing and demonstrating good balance, I'll put him on free weights. So anyway, 2 points I want to take, I'll give you to take home. Knowledge, I hope you learned something, and some awareness that TBI can affect anybody. So there are my references, and thank you for listening to my presentation. Have a good day.